Thanks very much for joining us today, everyone. We have Dr. Shahab and Scott Livingstone, CEO of the Saskatchewan Health Authority, in the room here with us. On the line, we have Dr. Susan Shah, the Chief Medical Officer of the Saskatchewan Health Authority. Dr. Shahab, do you have an opening statement?
Yeah. So good afternoon, everyone. I'll just maybe go over some information about new cases, some information about events, and some general information about social distancing first. So in terms of cases, as you know from the news release, we have 9 new confirmed cases of COVID-19, bringing the provincial total to 104. 6 individuals are hospitalized, 1 hospitalized in the north, 2 hospitalized, and 1 in ICU in Regina, so 3 in Regina, and 1 in hospital and 1 in ICU within a hospital in Saskatoon, so a total of 6 individuals hospitalized. We have identified 6 cases as a result of local transmission, so community transmission, including an additional case in the central region. So 2 local transmission in Regina, 2 in Saskatoon, 2 in central Saskatchewan. The other cases are either travel-related, contacts of travel-related, or mass events that were somehow linked to someone who had traveled. Of the confirmed cases, we have 4 cases under 19 years of age. The rest are adults, including 49 cases in the 20 to 24 age range, 33 in the 45 to 64 age range, 18 65 plus. 57% are males and 43% are females. So all this detailed demographic information is now on the website. 3 people, I'm happy to say, have recovered. So as we can see now, with 3 weeks, almost three and a half weeks since we had our first case, we can see now people coming out of, for the most part, a mild illness and recovering. So 3 cases have recovered. But we were also expecting to see, unfortunately, hospitalizations, so we're seeing that as well. To date, 7,580 COVID-19 tests have been performed. Now, we are continuing to see cases linked to events or mass gatherings, such as a snowmobile rally north of PA on March 14th. And this really substantiates why we have reduced further the limits on large events to 10 from 25, but also it reinforces the message that irrespective of whether it's 2 people or 5 people or 10, you really need to keep social distance, and you can go out for a walk, you can go out snowmobiling because you automatically maintain that distance, but don't share food, don't have potlucks or picnics together, because that seems to be an issue in mass gatherings. In terms of social distancing, obviously we've received lots of questions through our COVID-19 line. And I think it's something that we really need to now practice as a routine. It's become part of our language now. But we also like to use the word physical distancing. That's keeping that 6-foot separation, but at the same time, keeping connected in terms of either through having a conversation, if there's more than 6-foot separation, or being in touch with friends and family through other means. Many of us have actually received calls or reached out to friends and family who we had not spoken to for months. So for many, it's an opportunity to have family time and to reach out to friends and family, especially through technology and other means. And it is really important through this time that we do this and support each other to remain well, both physically and mentally. So going for solitary walks is important, remaining in touch is important. Unfortunately, if you are ill, you are required to stay indoors. You should avoid being outdoors at all. If you are a close contact, you should not go shopping, but you can, if it's appropriate, go to your backyard, or if you live in a part of town where it's possible to take a solitary walk, you can do that. But we all have to be cautious if we are on home isolation as close contacts or as travelers to not go to environments where we're opening doors that others may also open, because that is also a risk for transmission. And we have to wait out that 14-day period, either as close contacts or as returning travelers. And cases, of course, they need to be cleared by public health. Initially, most cases were tested after completing a 14-day period. Now, for the most part, cases who had a mild illness are 14 days after the onset of symptoms will be cleared by public health to go about the daily business. But healthcare workers, other essential workers, may require confirmatory testing. And finally, I'd just like to say that while most of us are home, and for some it's family time, for some it's challenge because we are not working, but there's opportunities by the federal and provincial government to reach out and get help. But we also have to understand that there are many people who continue to work and have to work. That includes people in healthcare, in other essential services, police, corrections, grocery stores, people who transport essential goods and services, all the people who are mentioned in the essential services list. And it is important that we all recognize them for the work they're doing at the front lines and support them in whatever way we can, while maintaining a physical distance, but maintaining that community cohesion and support. Thank you.
Mr. Livingstone?
I don't have any comments.
Operator, we'll take our first question from the phone line.
We have Adam Hunter with CBC.
Hi there. I'm wondering when we are expanding the testing for people who are experiencing symptoms that may not be the main symptoms. We've heard from someone who tested positive that had a loss of smell and taste, also diarrhea. She wouldn't have made the list initially. I'm wondering when we may be expanding the list of people or the criteria for people who are tested to catch more cases. Thank you.
Yeah, thanks. So it's really important that we conserve testing for people who require testing. So we have on our website information for the public around testing, and also we have on the website information for health professionals about who is prioritized for testing. So obviously, people who are providing essential services like healthcare workers and other staff, if they get a dry cough, you want to know if is it COVID-19 or not COVID-19, so they will get tested. If it's just a dry cough, no fever, the test is negative, they can continue to work. Obviously, if they have a cough and fever, they need to stay home anyways, but they will get tested. If the test is negative, they can go back to work once the fever is settled. If it's COVID-19, they need to wait. Usually it's 2 weeks before they can come to work. So that's for essential services. For others now, our guidance is different from what it was before. If you have traveled, you have to stay home now 2 weeks. That is mandatory. That's not an option. 3 weeks ago or 4 weeks ago, we were saying self-monitor after coming back. Then we were saying we recommend you self-isolate. Now, as returning travelers, it is mandatory that you stay home for 2 weeks. Within those 2 weeks, if you get a mild cough, no fever, you do not require to get tested. Even if it's COVID-19, if your cough is there for 2-3 days and then it goes away, you would have cleared the virus. You do not need testing. Stay home for 2 weeks till your symptoms are cleared. If you get fever, other symptoms that are more significant as a return traveler or as a close household contact, then yes, you should call your healthcare provider or health line, and you will be assessed and directed to an assessment center or a testing center for testing. Second, so that's the category in terms of who should get tested and who should not. Then primary care physicians obviously are now giving advice over the telephone, but they will obviously assess you clinically if required due to an emergent issue. So while the characteristic symptoms of COVID-19 are malaise, headache initially, but then fever, cough, and then it can lead to shortness of breath, testing really is recommended if there's fever and cough at least, with or without shortness of breath. It is unusual to have diarrhea or other illnesses as a presenting complaint. However, your primary care physician will assess you, and if he thinks that testing for COVID-19 as well as other tests required to diagnose you clinically are required, he can, of course, request testing. But we all have to conserve testing for people who need it the most. And so if you're well, we don't need testing. If you have a dry cough, irrespective of travel, stay home till your cough is gone. If you have not traveled and you have a mild fever, again, you can wait for a day or two to see if it goes away. But if it's significant or worsening, or if you are older than 65 or have underlying risk factors, do call Healthline or do talk to your primary care physician or nurse practitioner to see if you need a clinical evaluation or need to be tested.
Is there a follow-up on the line?
Yes. What is the status of PPE and other needed protection for frontline healthcare workers, people that are doing testing? There's been some concerns, I know, in other places and even in Saskatchewan. What's the update on if we have enough stock to keep our healthcare workers protected? Thank you.
So currently, we do have enough PPE to supply healthcare workers across the province that need that protection to care for patients. We have a number of different items on order and are expecting those orders in upcoming weeks. But as you know already, across the world and in Canada and Saskatchewan, there are limits on what we're getting because it's being distributed equitably by manufacturers. So we're getting our orders, but we're not getting exactly what we ordered.
Steph?
To the point about the PPE, you obviously sent a memo or a note out saying there's concerns about some of these going missing. Can you quantify that for me? Like, how much has the SHA seen gone missing in terms of the masks, the gowns, the surgical, the other?
So we can't give you an exact number, but what I can tell you is that before the memo came out, we looked at the last few weeks of ordering and distribution of supplies within the SHA, and we're receiving orders for 4 to 5 times our normal supplies for PPE, and that was factoring in the amount of PPE we're using to fit and test for staff, and it was not on wards. So what we have done is we've now centrally located all our supplies. We've put supplies under lock and key. We no longer have supply carts sitting there open with supplies, and we're centrally distributing. We're putting locks on doors, and we're investigating known losses as we speak.
How did you confirm that some of these supplies are going missing? How have you been able to confirm that?
Because they're not in our inventory.
Right, but how do you know they're not just being used for like an appropriate?
Because we don't typically use PPE supplies on a day-to-day basis, and when we have, at the time 2 weeks ago, we had nobody in the hospital with COVID-19.
At this point, has any staff member, a volunteer, been punished, reprimanded for taking this inappropriately, stealing it?
No.
We'll take our next question from the phone line, operator.
We have Lisa Schick with CJME.
Hi. I am just wondering, you say there are 6 cases of local transmission now. How can you know that's all the local transmission we've had if you're only testing a narrow set of people?
So right from the beginning, we have been testing anyone who's hospitalized for severe respiratory illness. So we have done hundreds of tests for people who are hospitalized or visiting ER. We are also testing any outbreak in long-term care facility where another organism has not been found. While till last week we were prioritizing testing for returning travelers, clinicians did have the discretion on a case-by-case basis to test anyone, and that is in fact how many of the cases of community transmission were discovered. And of course, frontline staff, including healthcare workers, other staff, were also undergoing significant amounts of testing. I don't have the exact numbers, but from some sites, assessment sites, out of the 7,000 or so tests, as many as 20 or 30% were being done in people who had not traveled. So similar to other jurisdictions, that was a good check to confirm that we are not missing community transmission. Having said that, now that we have seen cases where there is no link to travel, that is exactly why, as of this week, we have changed the testing criteria. And to conserve testing, we have then said, if you have traveled, we had a very big magnifying glass on travelers. But now we are saying, if you have traveled, you have to stay home for 2 weeks anyways. And we have to remember that out of 7,000 tests, 100 are positive. So the test positivity rate is very low, which is a good thing. So most people who were returning travelers who were seeking testing were actually testing negative. That's a good thing. But we now know from our experience and from the experience of other provinces that the vast majority of people who have traveled, air travel, long trips, they do have a dry cough sometimes for 2-3 days. They do not require testing. If there's no fever, they have to stay home isolation, not voluntary, not a recommendation, but mandatory, under significant penalties both by the provincial government and the federal government. So that should decrease testing in the vast majority of returning travelers to only testing where there's fever, other symptoms, and that will now give the space to test people as a priority who are healthcare workers, essential workers, people who have not traveled but who are over 65, have underlying conditions, or even otherwise who have cough and fever and shortness of breath, not just cough. Anyone who has just a cough should stay at home unless they're an essential worker where they will be tested. So in this way, we have expanded the criteria for testing while conserving testing by not recommending testing for the vast majority of travelers who just have a cough and should, in any case, stay on home isolation for 2 weeks.
Is there a follow-up?
Yeah, so you have the requirements for testing, the criteria for testing, but we know that there are people who might have this virus who have very, very mild symptoms. So how do we know that there aren't clusters maybe of community spread somewhere that hasn't been checked because we're not testing everybody who asks for it? There's such a narrow criteria.
Well, we do know that this COVID-19 will transmit within the population. We want to maintain that transmission as low as possible. And that is exactly why we have, not recommended but mandated that there be no group events of larger than 10, either in public or in private. Some of the largest outbreaks in Canada have been in the home setting, where people have gathered together and shared a meal. So it's now a public health order that you cannot get together, even in a home setting, unless you live in the same household. That is critical. It seems harsh, but that is critical to limit further transmission. Similarly, if you are going to work as an essential worker, healthcare, other sectors, there is a recommendation that you do not eat as a large group. You do not share the lunch you bring from home. Even there, while at work, your behavior has to change. If you're out for a walk, you have to maintain your social distance. If you are out shopping, you should go alone, not the whole household. You should pick up what you need, put it in your trolley, come back, not touch your eyes, nose, and mouth, and wash your hands once you come back. All these behaviors are exactly to decrease further community transmission. And that is essential because if we don't do that, we will see more cases. And if we all do that, we will be able to flatten the curve. And my last comment would be that as we get more and more cases, it does take sometimes 1 to 2 weeks for either people to recover, the vast majority, or unfortunately 2 to 3 weeks for people to develop more serious symptoms which may require hospitalization. So the fact that we have seen only 6 cases of hospitalization, and remember, all hospitalizations with a history, respiratory symptoms that could be COVID-19 have been tested for the last 4 weeks now. So the fact that we have seen 6 hospitalizations, 4 in acute care wards, 2 in ICU, is also a good check to see that we are not missing a large amount of community transmission. We already know from other countries that about 80% of cases in all age groups have mild illness, 20% require hospitalization, especially if they're older, and 5% require ICU care. So based on the numbers of hospitalization, which would always be tested in hospital, we are confident that we have not missed large amount of community transmission to date. But having said that, a few days ago when we first saw community transmission, we knew that we have reached a critical point, and we will see high levels of community transmission if we don't follow exactly the recommendations that are laid out. Physical distancing, only going for essential shopping, only taking part in activities as a household where you keep your physical distance from other members in the community. It's hard, but that is essential for the next little while.
We'll take another question from the phone line, operator.
We have Roberta Bell with Global.
Hi, I had a question about the rate of increase. We're hearing in BC that it's been halved from 24% to 12%, but in Saskatchewan it looks like we are still climbing, although at a somewhat steady rate. Can you tell us a little bit about what the pattern has looked like in Saskatchewan over the past 3 weeks and what you're expecting in the future based on that?
So, sorry, the rate of increase.
And the rate of increase in cases.
Yeah. So that's a really good point, and I would like to specify that we have no control over people coming back to Saskatchewan. And so we already know that there will be a certain number of people returning, either short-term visitors or people coming back after winter in the south. So we don't have any control over the number of people coming, and we already know that a small percentage of those will test positive. They have to stay home for 2 weeks. We hope that will result in no further transmission. If you come back, you are not to go to any group event, visit any friend, neighbor, relative till those 2 weeks are over. But that's going to be a steady number for the next little while. Our most important cases we need to watch are those which have no history of travel and no history of being at a group event where someone who traveled was there. We think that should not happen anymore now. It's actually against the law to partake in a group event if you've traveled within 2 weeks. But having said that, we have to watch very closely if our cases of community transmission increase. Right now they're at 6. If we do everything I described before, we will flatten the curve. Other countries have shown that you can flatten the curve, maintain community transmission at a low level. And we have to watch that and maintain that. So, based on that, I think we need to watch that. But of course, if we start to see an increase, we need to understand what was the issue that resulted in that, and then we can improve our advice based on is there something that we missed in terms of our public health order and recommendations. For example, over the last couple of weeks throughout Canada, there's been obviously concern that any group event, small, large, if the sharing of food, if someone has mild symptoms, they shouldn't be at the group event. They touch their eyes, nose, mouth, they touch a spoon, and then someone else takes the food, and then it may be finger food. That's how transmission happens. So really have to be wary of not actually having any meals together if you're not in the same household, and not going out, even shopping, if you have any symptoms. And that we are hoping will keep the curve as flat as we possibly can.
Is there a follow-up?
I had a question about ventilators as well. Could you tell us how many ventilators for the SHA, how many ventilators are currently being used in Saskatchewan of the ventilators we have, and how many are being used by COVID patients and non-COVID patients?
Dr. Shaw, do you want to take that question?
Yeah, so it's Susan Shaw speaking from Saskatoon. I'm the Chief Medical Officer. I can't tell you exactly how many ventilators are currently in use. I can tell you that at the most, for a COVID patient, at the most it would be 1. We have in total, across the health authority, we have, in addition to the adult ventilators that we've talked about before, we have an additional 80 subacute ventilators and over 160 operating room ventilators that could be available to us. And we have also the non-invasive ventilators. So I think that for the current state of where we're at, considering that we only have at most 1 patient with COVID requiring a ventilator, the system is prepared well. And we anticipate that with ongoing good social distancing and compliance and commitment from the public to keep flattening the curve, that we will be in good stead.
Steph?
Mr. Livingstone, I just want to be clear. Do you believe that some of the personal protective equipment is going missing because Saskatchewan Health Authority staff are taking them?
I think the PPE is disappearing for lots of reasons. I know for a fact that staff are involved. There could be patients, could be physicians, it could be anybody who comes into our facilities. In many of our facilities across the province, we have open carts and open cupboards with this type of equipment in it. We don't have that any longer, and it's locked down. But yeah, I am saying that people who work for the SHA have removed PPE from our facilities.
I just want to, I mean, how would you respond to people saying that feels a bit accusatory? You know, these frontline staffs are kind of busting their butts right now. They're under a lot of pressure. And then you have yourself, the head of the SHA, saying, you know, we think that some of you guys might be taking it. How do you respond to people maybe taking a bit of offense to what you're saying?
Well, for those that take offense, you know, the memo that was sent out was very clear on that, you know, the vast majority of the people that work for the SHA are coming to work each and every day to care for our patients and care about the safety of those they work with and themselves. We do know that PPE has disappeared from the SHA through our employees and other people who work in our facilities. And for those folks, the memo was very clear. You know, even if it's fear-based, and I get that, there's lots of fear out there. There's fear in the public. There's fear, of course, in our healthcare workers. But if that PPE isn't available when people need it to properly care for COVID-19 patients, they're putting people's lives at risk. And that's why that memo was sent out.
We'll take a next question from the phone line, operator.
We have Guy Quinville with CBC.
Yeah, hi. So just a couple hours ago, the Ministry of Justice or Corrections confirmed that 2 Saskatoon correctional guards have tested positive, I think presumptive positive virus. So I wanted to ask you, Dr. Shahab, regardless of whether they're at the presumptive or the confirmed stage, these 2 cases, what should the Ministry of Corrections do to prevent any further spread of the virus within these, you know, enclosed facilities where there's a lot of people in one room? And are you actively giving advice as we speak to corrections to that effect?
Yes, thank you. So I understand there's a news release that has gone out describing in detail the situation in Saskatoon Corrections. And as a matter of routine, public health locally works closely with all institutions, whether it's long-term care, personal care, or other institutions like corrections, to work in a collaborative way to manage any outbreaks. And actually, there's a very strong working relationship between Saskatoon Public Health and Saskatoon Corrections. And they were actually already working on an unassociated respiratory outbreak that was being managed and was actually ending. So they already were working closely on an outbreak that had nothing to do with COVID-19. And then once one, and then as of yesterday, a second person in that setting tested positive, then the standard approach is being applied, where obviously if you are symptomatic and you test positive, you stay home till you've cleared the virus. Any close contacts that you may have had during, if you were at work while symptomatic, they are assessed and either cohorted or segregated if they are inmates of the facility, or if they are staff, because they are essential workers. They undergo active daily surveillance by public health and by occupational health. So if they can stay at home, they stay at home. If they need to come to work because there's no one to replace them, then they can come to work under medical supervision. And at the first sign of symptoms, they are isolated and, of course, tested. Applies to both staff and inmates. And if there was someone who test positive as a result of this, they will either be isolated at home if they're staff, or they will be isolated safely within the facility. As we know, most people, whether staff or inmates, will recover after a relatively mild illness, but obviously if anyone requires a high level of care, that will be arranged. So this is being managed in a very systematic way right now, and I would expect both the corrections facility and the SHA Public Health to provide regular updates as required. But this is a routine collaboration that happens for influenza outbreaks, norovirus outbreaks, and in many respects, COVID-19 is very similar to that in terms of how it's managed.
Is there a follow-up?
Yeah, I'm just wondering if you can, two-parter, if you can just absolutely confirm, do we have 6 or 7 cases of community transmission now, and can you break down which specific communities, as much as is possible, where all those cases are currently?
So at this point, we have 6 cases of community transmission, 2 in the Regina area, 2 in the Saskatoon area, 2 in the central Saskatchewan area. but we have to remember that whether it's 6 or 7 or whether it's going to be more, we need to, wherever we are in Saskatchewan, we need to now act and behave as if there is community transmission. We will not be able to test every case. Many cases will be so mild they may not themselves know that they are sick. And that is fine. As long as we practice very regularly all the things we were talking about, our social distancing behaviors, we will minimize as much as we can, large clusters or large outbreaks, but we will see some onward transmission. We will see our case numbers increase, but we want to keep that slope of increase as flat as possible.
Karen?
Mr. Livingstone, I just wanted to follow up on the planning, the pandemic planning. Is the rural plan the same as the urban plan, or are there differences?
So the plans for rural, north, and there are 2 bigger urban centers, and I would include PA in that, all are being done under the same context of with respect to the principles around what will apply to how we're going to, for example, cohort COVID-19 patients based on the data that they now have by area to build the plans to appropriately operationally respond to COVID-19. So the answer to your question, are the rural plans going to be identical to the urban or north? No, they won't be identical because it's going to be based on the volume of patients that they may see and the type of care that they may require. Also, always understanding that in our bigger centers, and that's the Saskatoons, the Regina, and the PA, that also draw patients from other areas of the province, there would have to be other considerations put in place for those centers where we will likely be sending the sickest of the sick.
So the rural facilities that are out there would have space. Do they have staff and the equipment that they need? So
it's a great question, and that's what the planning teams are doing now as they look through how we respond operationally throughout the province to COVID-19 as it evolves in the province. We will determine where patients will be cared for in local facilities, what type of staffing is required to ensure that we have the right staff in place, and what type of equipment will have to be put in place to support that care.
We'll go to the phone lines for our next question, operator.
We have Laura Woodward with CTV.
Hey there, I'm just wondering if it's safe for people to buy used items from strangers online right now through things like Marketplace or Kijiji, and what should people be doing to minimize the risks, or should they be doing it at all?
Yeah, so we get these questions a lot through our online email. The science on coronavirus is emerging, and we have seen some science reviews where they say that maybe if it's a stainless steel surface, it can live for more than a day. If it's a porous surface like paper, it doesn't last more than a few hours. I think the general principles are the same. When we go out, even if you open a door that's like in a grocery store or other settings or our apartment block, you open the door, you come in, you wash your hands. You don't open the door and touch your eyes, nose, mouth. So I think that goes for those kind of settings. We have not had any reports of someone getting something online and then getting sick from touching that package. Beyond that, I think we all have to apply a judgment. I know through Kijiji or Marketplace, there may be something that someone may bring to your house, whether it's a used item. I think we just have to apply our judgment. We have closed many places like restaurants and gyms exactly for that purpose, that if you touch a surface and then someone touches that surface again, there is a risk. It may be low, but there is a risk. So if you want to be extra cautious, you should wipe down whatever you've bought. If it can be wiped down or if it can be laundered or washed, do that, or let it sit out for a few hours in the garage for 2-3 days. I think those are some extra layers of caution we can apply depending on what our purchase is, and to keep us, even safer.
Is there a follow-up on the line?
Yeah, I'm just wondering, Scott, you're speaking a little bit about PPE going missing from health facilities. Can you speak to what type of products are getting taken by staff?
Masks, gowns, gloves.
We've got time for a couple more questions, Steph.
Dr. Shahab, can you give an updated number on how many of the positive COVID-19 cases are associated with that snowmobile rally that took place at Christopher Lake on the 14th? I think there was 2. Is that changed at all?
So I'm aware of 2, but there are several who have some symptoms. So they are being assessed. Obviously, not everyone with symptoms needs to get tested, because if your symptoms are not COVID-19 related, you don't need testing, but you need to be on isolation for 14 days. But if you have symptoms that are significant, then there may be some further testing done. So usually it takes for up to a week or 2 weeks. Actually, it takes up to 2 weeks after an event to know how many ultimately were associated with an event. But everyone who has been notified really does need to take precautions in terms of being on self-isolation.
Do you know that number off the top of how many are notified and how many should be self-isolating who attended that event?
So I think there were about I don't know exact numbers. I think there were more than 50 people who attended the event, but at least 50 are being assessed for symptoms. 2 are positive, but that communication has gone out to everyone who attended that event.
An important clarification is, you've talked a lot about testing today. Why do we need to conserve testing?
So at this point, we are not short on testing supplies and reagents, but we do know that this situation is going to continue for several weeks to months, and we need to rationalize who gets tested. We all know that even by going to get tested, if you were infectious, you are creating some risk for others, whether you're in terms of how you travel. So what experience in other jurisdictions in Canada has shown is that 80% people have mild symptoms. Of that 80%, 40% actually have symptoms that are so mild that if we weren't so hyper aware of our symptoms, we wouldn't even notice that, just a dry cough. But even with a dry cough, where otherwise you would be out and about, we are saying if you have traveled or if you're not, have not traveled, but in any ways, stay at home. Practice social distancing at all times. Just go out for shopping or for things that you do, among a small group household. But don't interact in the general public in a way that you expose others, even if you're asymptomatic. But even if you have a dry cough, stay home as an extra precaution for the 2 or 3 days. You don't need to get tested. But if you have a cough and fever, yes, in that case, talk to Healthline. If you have underlying risk factors or medical conditions, diabetes, heart disease, lung disease, that's worsening, have that discussion with with the primary care provider. Initial discussion could be on telephone. And then if you need testing for your clinical management or you need an assessment for your underlying conditions, you will maybe offer testing if the symptoms are aligned. So that's how we want to rationalize testing. But finally, any outbreak or cluster, whether it's in an inpatient facility, will get tested as a priority. And similarly, if it is a cluster, obviously we don't have those group settings anyways, but if there's a cluster in a daycare, even a small daycare now, that must get investigated.
We have time for one last question on the phone line, operator.
We have Ashley Martin with the Leader Post.
Hi. So if someone is being tested for COVID-19, how long does it take for the results to come back?
Yes. So we are trying to fast-track testing for essential workers, including healthcare workers. So because if someone is at work and develops a dry cough, they may have to wait a day or 2, because if you test too early, the test may be a false negative. So you wait a day or 2. If your symptoms go away, you may come back to work, but if you are a frontline healthcare provider, you then are tested if the symptoms are persisting. And if they're negative, you can go back to work as long as you don't have a fever or another viral infection. But if they're positive, then of course you have to stay on isolation at home for 2 weeks. So testing for healthcare workers is being done in a day or 2, depending on where you are in the province. Similarly, testing for outbreaks, whether it's a long-term care facility, is prioritized to be done in a day or 2. Testing for others, for example, if you've traveled and have a fever and need to be tested, you may get tested. That result may take longer, but it doesn't change your management, because if you have mild illness, you have to stay at home for 2 weeks anyway. So in that situation, it doesn't change what you need to do, because you have to stay home in any case if you have fever, cough, and have traveled.
Mr. Livingston?
No, Dr. Shahab
Okay, great.
actually answered the question.
Is there a follow-up on the line, Ashley?
Follow-up, sort of unrelated, but with patients who are currently in the hospital, whether it's in ICU or normal acute care, how are they being isolated from other patients to prevent the spread?
Dr. Shaw?
So we continue to follow good infection prevention and control guidelines. Patients who are either being suspected of or have confirmed COVID are being isolated, and staff are using full precautions as per the guidelines. If their staff are involved with an aerosol generating medical procedure, then that's when they would use a N95 mask. If not, they would be using a medical procedure mask, as well as at all times we would be using a face shield, a full gown, gloves, and of course paying a lot of attention, as we always do, to hand hygiene before and after any patient encounter.
Thanks very much, everyone. That's all the time we have for today.